Hello everyone, Dr. James Whittaker here, and today we're going to tackle one of the most overlooked causes of erectile dysfunction and sexual performance problems in men. If you've been struggling with sexual issues and can't figure out why, the answer might be sitting right in your medicine cabinet. Millions of men are unknowingly sabotaging their sexual health by taking medications that directly interfere with erectile function, libido, and overall sexual performance. The tragic part is that many of these men have no idea their medications are the culprit, leading them to seek expensive treatments, feel inadequate, or strain their relationships unnecessarily. What's even more concerning is that many healthcare providers don't adequately warn patients about these sexual side effects, either because they're uncomfortable discussing sexuality or because they underestimate how important sexual health is to their patients' quality of life. Today, I'm going to walk you through the most common medications that can destroy your sexual performance, explain exactly how they work to cause these problems, and most importantly, share strategies for managing these effects while still protecting your health. Before we dive into specific medications, it's crucial to understand the basic mechanisms by which drugs can interfere with sexual function. Sexual performance depends on a complex interplay of psychological, neurological, hormonal, and vascular factors, and medications can disrupt any or all of these systems. Many medications affect sexual function by interfering with neurotransmitters in the brain that control sexual desire and arousal. Others impact the blood flow necessary for erections by affecting the cardiovascular system. Some medications alter hormone levels, particularly testosterone, which is essential for libido and sexual function. Additionally, certain drugs can affect the nervous system's ability to send and receive the signals necessary for sexual arousal and orgasm. Understanding these mechanisms helps explain why some medications cause more severe sexual side effects than others. The timing of when sexual side effects develop can vary dramatically. Some men notice problems within days of starting a new medication, while others may not experience issues until they've been taking the drug for months or even years. Blood pressure medications and sexual function. Let's start with one of the most commonly prescribed categories of medications that can significantly impact sexual performance: blood pressure medications. While controlling high blood pressure is absolutely crucial for cardiovascular health and actually supports long-term sexual function, many of the medications used can cause immediate sexual side effects. Diuretics, often called water pills, are frequently the first line of treatment for high blood pressure. Medications like hydrochlorothiazide and chlorthalidone can cause erectile dysfunction in up to 25% of men who take them. These drugs work by reducing blood volume, which can decrease the blood flow necessary for strong erections. Beta blockers, including propranolol, metoprolol, and atenolol, can cause erectile dysfunction and reduce libido by blocking the nervous system signals that promote sexual arousal. These medications also reduce overall energy levels and can cause fatigue that interferes with sexual interest and performance. Calcium channel blockers like amlodipine and nifedipine are generally better tolerated from a sexual function standpoint, but they can still cause problems in some men, particularly erectile dysfunction due to their effects on blood vessel function. However, it's important to note that not all blood pressure medications cause sexual problems. ACE inhibitors and ARBs, angiotensin receptor blockers, like lisinopril, losartan, and telmisartan, may actually improve sexual function by improving blood flow and reducing inflammation in blood vessels. Antidepressants and sexual performance. Antidepressant medications are among the worst offenders when it comes to sexual side effects, affecting up to 70% of people who take them. This creates a particularly cruel irony, as depression itself can cause sexual problems, but the medications used to treat depression often make these problems worse. SSRIs, selective serotonin reuptake inhibitors, like sertraline, paroxetine, fluoxetine, and citalopram, are notorious for causing sexual dysfunction. These medications increase serotonin levels in the brain, which can significantly suppress libido, delay or prevent orgasm, and cause erectile dysfunction. The sexual side effects of SSRIs can be particularly devastating because they often affect multiple aspects of sexual function simultaneously. Men may experience reduced interest in sex, difficulty achieving or maintaining erections, delayed ejaculation, or complete inability to reach orgasm. SNRIs, serotonin norepinephrine reuptake inhibitors, like venlafaxine and duloxetine, can cause similar sexual side effects, though sometimes to a lesser degree. However, individual responses vary significantly, and some men find SNRIs more tolerable than SSRIs. Tricyclic antidepressants, while less commonly prescribed today, can also cause significant sexual dysfunction through multiple mechanisms, including effects on neurotransmitters, blood flow, and hormonal function. Before we continue exploring these medication effects, I want to ask you to hit that subscribe button and ring the notification bell. I publish new videos every week about men's health topics that mainstream medicine often overlooks or inadequately addresses. Understanding how your medications affect your sexual health could transform your quality of life and relationships. Medications for prostate problems. Medications commonly prescribed for enlarged prostate can paradoxically cause sexual dysfunction, even as they're intended to improve urinary symptoms that may be affecting quality of life. Understanding these effects is crucial for making informed treatment decisions. Alpha blockers like tamsulosin, alphazocin, and doxazocin can cause erectile dysfunction and, particularly concerning, retrograde ejaculation, where semen travels backward into the bladder instead of being expelled normally. This can significantly impact sexual satisfaction and fertility. 5-alpha reductase inhibitors, including finasteride and dutasteride, can cause more severe and potentially long-lasting sexual side effects. These medications work by blocking the conversion of testosterone to dihydrotestosterone, DHT, which can lead to reduced libido, erectile dysfunction, and decreased semen volume. What's particularly concerning about finasteride is that some men experience persistent sexual side effects that continue even after stopping the medication, a condition known as post-finasteride syndrome. While this is controversial and not universally accepted, many men report ongoing sexual dysfunction long after discontinuing the drug. Antihistamines and decongestants. Many men don't realize that common over-the-counter medications for allergies and cold symptoms can affect sexual performance. Antihistamines like diphenhydramine, loratadine, and cetirizine can cause erectile dysfunction and reduce libido, particularly when used regularly or in higher doses. These medications work by blocking histamine receptors, but they can also interfere with other neurotransmitter systems involved in sexual function. The sedating effects of some antihistamines can also reduce energy and interest in sexual activity. Decongestants containing pseudoephedrine can cause erectile dysfunction by constricting blood vessels throughout the body, including those necessary for penile blood flow. While these effects are usually temporary and resolve when the medication is stopped, regular use can cause persistent problems. Anti-anxiety medications. Benzodiazepines like alprazolam, lorazepam, and diazepam can significantly impact sexual function through multiple mechanisms. While these medications can reduce performance anxiety that might be contributing to sexual problems, they also depress the central nervous system in ways that can interfere with sexual arousal and performance. Long-term use of benzodiazepines can be particularly problematic as tolerance develops and higher doses are needed to achieve the same anti-anxiety effects. These higher doses are more likely to cause sexual dysfunction, creating a difficult situation where the medication needed for mental health interferes with sexual health. The sedating effects of benzodiazepines can reduce libido and energy for sexual activity. Additionally, these medications can interfere with the ability to achieve and maintain erections and can delay or prevent orgasm. Acid reflux and stomach medications. Proton pump inhibitors, PPIs, like omeprazole, lansoprazole, and esomeprazole, commonly used for acid reflux and stomach ulcers, can affect sexual function in ways that many men don't realize. These medications can reduce the absorption of important nutrients like vitamin B12, magnesium, and zinc that are essential for sexual health. Long-term use of PPIs has been associated with reduced testosterone levels, which can lead to decreased libido and erectile dysfunction. The mechanism appears to be related to the medication's effects on hormone production and nutrient absorption. H2 receptor blockers like ranitidine and famotidine can also affect sexual function, though usually to a lesser degree than PPIs. These medications can occasionally cause erectile dysfunction and reduce libido, particularly with long-term use or higher doses. Pain medications and opioids. Opioid pain medications can have devastating effects on sexual function through multiple mechanisms. Chronic opioid use suppresses the hypothalamic pituitary gonadal axis, leading to dramatically reduced testosterone levels, a condition known as opioid-induced hypogonadism. Medications like morphine, oxycodone, hydrocodone, and fentanyl can cause severe erectile dysfunction, complete loss of libido, and inability to achieve orgasm. These effects can occur even with relatively low doses when used chronically. The sexual dysfunction caused by opioids is often severe and can persist for months after stopping the medication. This creates additional challenges for men who need these medications for legitimate pain management but want to maintain sexual function. Even non-opioid pain medications can affect sexual function. NSAIDs like ibuprofen and naproxen, when used regularly, can interfere with testosterone production and may contribute to erectile dysfunction in some men. I want to hear from you in the comments below. Have you experienced sexual side effects from medications you're taking? Were you warned about these potential effects when the medication was prescribed? Sharing your experiences helps our community understand these important connections and supports other men facing similar challenges. Cholesterol medications and hormones. Statin medications used to lower cholesterol can have complex effects on sexual function. While these drugs can improve erectile function by reducing atherosclerosis and improving blood flow, they can also interfere with hormone production in ways that may reduce libido. Statins work by blocking an enzyme involved in cholesterol production, but this same enzyme pathway is involved in testosterone synthesis. Some men experience reduced testosterone levels and decreased sexual interest when taking statins, though this effect varies significantly between individuals. The timing of these effects can be confusing, as the cardiovascular benefits of statins may initially improve erectile function, but hormonal effects may cause problems over time. This makes it important to monitor both sexual function and hormone levels in men taking these medications long-term. Seizure medications. Anti-seizure medications can significantly affect sexual function through multiple mechanisms. Drugs like phenytoin, carbamazepine, and valproic acid can interfere with hormone production, neurotransmitter function, and the neurological pathways involved in sexual response. These medications often cause multiple sexual side effects simultaneously, including reduced libido, erectile dysfunction, and problems with orgasm. The effects can be particularly challenging because seizure medications typically need to be taken long-term for safety reasons. Some newer seizure medications may have fewer sexual side effects, but the relationship between seizure control and medication choice requires careful discussion with a neurologist who understands the importance of sexual health to quality of life. Hair loss medications. Finasteride, commonly prescribed for male pattern baldness, deserves special attention due to its significant potential for sexual side effects. This medication works by blocking the conversion of testosterone to DHT, which can preserve hair but may also cause erectile dysfunction, reduced libido, and ejaculatory problems. What's particularly concerning is that some men develop persistent sexual dysfunction that continues even after stopping finasteride. While the exact incidence of this post-finasteride syndrome is debated, it's clear that some men experience long-lasting sexual problems after using this medication. The decision to use finasteride for hair loss requires careful consideration of the risk-benefit ratio, particularly given that the sexual side effects can be severe and potentially permanent in some cases. Sleep medications. Sleep aids can affect sexual function in ways that many men don't anticipate. Prescription medications like zolpidem, isopoqualone, and zaleplon can cause erectile dysfunction and reduce libido, particularly with regular use. These medications work by depressing central nervous system activity, which can interfere with the neurological processes necessary for sexual arousal and performance. The sedating effects can also reduce energy and interest in sexual activity. Over-the-counter sleep aids containing diphenhydramine can cause similar problems, particularly with regular use. The anticholinergic effects of these medications can interfere with the nervous system signals involved in sexual function. If you're experiencing sexual side effects from necessary medications, there are several strategies that can help minimize these problems while maintaining the health benefits of your treatment. The first and most important step is open communication with your healthcare provider. Many doctors don't adequately discuss sexual side effects, but this conversation is crucial for finding solutions. Your doctor needs to know how medication side effects are affecting your quality of life. Timing adjustments can sometimes help minimize sexual side effects. For some medications, taking them at different times of day or adjusting the dosing schedule can reduce their impact on sexual function without compromising their therapeutic effects. Dose optimization is another important strategy. Sometimes sexual side effects are dose-dependent, and working with your doctor to find the lowest effective dose can preserve sexual function while maintaining health benefits. In many cases, alternative medications within the same therapeutic class may have fewer sexual side effects. For example, bupropion is an antidepressant that actually tends to improve sexual function rather than impair it, making it a good choice for men who need depression treatment but want to preserve sexual health. For blood pressure control, ACE inhibitors and ARBs generally have fewer sexual side effects than diuretics or beta blockers. Calcium channel blockers may also be better tolerated from a sexual function standpoint. When treating enlarged prostate, newer medications like tadalafil, which also treats erectile dysfunction, can address urinary symptoms while actually improving sexual function. Regardless of what medications you're taking, certain lifestyle modifications can help counteract their sexual side effects. Regular exercise improves blood flow, hormone production, and overall energy levels, which can help maintain sexual function even when taking medications that might otherwise interfere. Stress management techniques, including meditation, yoga, and adequate sleep, can help minimize the sexual side effects of medications while improving overall health and well-being. Nutritional support, including adequate zinc, vitamin D, and B vitamins, can help maintain sexual function. Some men benefit from supplements that support nitric oxide production or testosterone levels, though these should be discussed with a healthcare provider. If you're experiencing significant sexual dysfunction that you believe is related to your medications, it's important to work with healthcare providers who understand both the importance of your medical treatment and your sexual health. Don't stop taking prescribed medications without medical supervision, as this could be dangerous for your health. Instead, work with your doctor to explore alternatives, adjust dosing, or add treatments that can help maintain sexual function. Consider consulting with specialists who understand medication-induced sexual dysfunction, including urologists who specialize in sexual medicine, or psychiatrists who are knowledgeable about sexual side effects of psychiatric medications. Understanding how medications affect sexual performance is crucial for maintaining both your physical health and your quality of life. While many medications can cause sexual side effects, this doesn't mean you have to choose between your health and your sexual function. The key is open communication with your healthcare providers, careful monitoring of how medications affect your sexual health, and proactive management of side effects when they occur. Remember that sexual health is an important component of overall health and deserves the same attention and care as any other aspect of your well-being. If you're taking medications and experiencing sexual problems, don't suffer in silence. Work with your healthcare team to find solutions that protect both your health and your sexual function. With proper management, it's often possible to maintain both. If you found this information valuable, please hit that like button and share this video with other men who might be struggling with medication-induced sexual dysfunction. Subscribe and ring the notification bell so you don't miss future videos about important men's health topics. Stay healthy, stay informed, and remember that you deserve both effective medical treatment and satisfying sexual health. I'll see you in the next video.